Hi, and welcome back to Keeping Up with Senior Solutions. We're here today to not only say hi and do our usual chit chat, but Jim and I are really pleased to have a special guest. And that special guest is Mark Boutwell, who is our Senior Solutions Social Services Director. And it does, you might think you know what that means, but believe me, Mark covers a lot of territory. He does an awful lot of different programs and projects, but we'll let him tell you about that. So, Jim, you're there, right?
I'm here, and I think Mark is really kind of the glue that puts this all together. And I think that's really an important situation for anybody to be in. And he does put in a few hours doing that, by the way. Just starting off, though, Mark, what we usually do is just, if you could tell us a little bit about your background, maybe your educational background, and then why you got into the Senior Solutions job.
Great, Jim. Thanks. And thanks, Joanne. My background is mostly in community mental health. I have a master's degree specializing in psychiatric rehabilitation that I got from what was then Johnson State College in northern Vermont. And I've worked all over Vermont in many of the community mental health agencies. Washington County Mental Health, Addison County Mental Health, and I worked for the local mental health agencies, Healthcare and Rehabilitation Services, HCRS, for 18 years. And I worked primarily with folks with serious and persistent mental illness, but I also actually spent the last 7 years of my work at HCRS working with folks with intellectual disabilities, doing behavioral programming, and I was the clinical coordinator for the developmental disabilities program there. So I have spent my career so far working in social services and mental health, and I grew up in a family which my father was a clergyman, so it's sort of in my blood to serve folks in the community. And I've been here at Senior Solutions going on 7 years in June. So I guess I've kind of figured out what I'm supposed to do here.
We're lucky to have you.
Thank you.
Yeah. Well, I know that you have a very, very deep background in social services. And with that in mind, we're going to try to pick your brain just a little bit and see if you can kind of give us an overview of what types of things you're involved in. And then we'll go back individually and talk more about each of them, if that's okay with you.
Sure.
All right. So what kind of programs and, what kind of projects do you supervise?
So as the Director of Social Services, I oversee really all our direct services with the exception of our volunteers. So one of the critical programs that we provide are the case management services that we provide to older Vermonters who are on the Choices for Care long-term home-based Medicaid program. And that program brings services into people's homes that enable them to live their lives at home as opposed to ending up in a nursing home or other facility-based care. And basically anyone you ask would typically want to stay at home. So we provide case management services to folks who are living at home and getting home-based services. And another program that's similar to that is the Moderate Needs Medicaid home care service, and we provide case management to that as well. Older Americans Act is a federal act that was, I believe, put in place either by Kennedy or Johnson, not sure, but it's
Okay.
been around for a long time. And that act also supports services to older Americans who are living in the community and need some sort of case management.
Yep.
Let's see, what else? Other programs? Well, I have a whole long list here.
Can I ask one question about the case management program?
You
I
bet.
think that's an integral part of connecting also with the community and with relatives to the people who have a person that has a case manager. How does one get a case manager? Do they apply for that? Because it's a very important service, I think, that we offer.
Sure. So that I'm glad you asked that, Jim. The way that you get a senior solutions case manager really is through the Choices for Care long-term home-based program. So people who are eligible for that program, you have to apply for it through the Department of Disabilities, Aging, and Independent Living. And so there are two aspects of the eligibility. There is the clinical aspect, which means you have needs that meet basically a nursing home level of care, and you have a financial situation that says you don't have the means to pay for those services. So Medicaid will pay for those. And so once you are found eligible for that program, then it's called Choices for Care, because you get to choose who you want to provide the case management and who you would like to provide the direct care services. So you can choose Senior Solutions as your case management agency, or you can choose the local visiting nurse association for case management. So really, and the same is true with the moderate needs program. For those who are not eligible for those services, we really direct them to our helpline, which is an information and referral and assistance helpline that's open every day from 8:30 to 4:30 to assist people with short-term kinds of needs. And sometimes we do assist people with case management with short-term needs, but we don't necessarily assign a case manager to them. We do some short-term problem solving, and then send them on their way. And they are always welcome to come back through the helpline with additional needs that they have. So our case management services are largely focused on our Choices for Care and moderate needs recipients.
And Mark, isn't it true that both the helpline and the case managers, they really bend over backwards to help people? If they have a client, they will track them and make sure that they help them with their applications. Tell us a little bit about how the case managers work.
Well, the case managers really are advocates. Their role is to make sure that their clients are getting the services that they are eligible for through Choices for Care. Or, in other areas, if a Older Americans Act case management client comes forth, really they're advocating for these clients. They're seeking out the services that they need. That they are going the extra mile. Actually, here's a little instance. Just yesterday, we got a call on our helpline in the afternoon of a fellow who was completely out of fuel. And he called his fuel company and they said, sorry, our drivers, we have a regular route and they're not going to be back in your area until next week. So basically, good luck.
Yeah.
Our helpline worked with this fellow. They helped him come up with some names of other fuel providers, and they asked me if I would make sure that our emergency fuel assistance was available. And at the end of the day, they found another fuel provider that would come out that evening, yesterday evening, and fill up his tank for him. So that's, that's really going the extra mile, is making
Right.
sure that these people get the services delivered
Yes.
that they need.
That's really wonderful.
Yeah.
Yeah, I love those kind of stories. That's great. Thank you. Wow. And I'm sure he's happy too.
I'm sure he was very relieved. It was a cold night last night.
Yeah.
When I
Not
got
a good
home,
night to be out of fuel.
my wife asked me when I got home to build a fire in our fireplace. She was chilling.
I bet that was very cozy.
Right.
Nice.
Right. How many case managers do we have in Senior Solutions?
We have 9 case managers. 3 are based in Brattleboro, 4 in Springfield, and 2, does that make 9? In White River Junction. Let me just highlight that one of those case managers is dedicated specifically to a program we have through the Veterans Association that provides basically the same kinds of services, homemaker services as the Choices for Care program to vets. And this is a program that is really growing quickly, and veterans who get services through the VA and are in need of home care can apply through the VA for these services. And again, similar to the Choices for Care program, we provide case management to make sure that those services are in place. So we have 9 case managers, one of whom is dedicated to the Veterans Directed Care program.
I know one of my jobs in outreach was to follow up with a survey of our case managers, and I was so impressed with the answers that I received from the constituents that we are serving. It was just so positive. Not only are they serving those kind of material needs if they run out of fuel or whatever, but the emotional needs that they are providing are just quite amazing.
These case managers they have huge hearts. They're so caring and giving. This, as we often say in this business, they're not doing it for the money.
Right.
For sure. You're right. They have giant hearts. They really do.
They love the work.
I was wondering, talking about the case managers, during COVID-19, how has this pandemic affected our services? Have you any comments on that?
Absolutely. It affected them very profoundly. So most of the time, what our case managers do is to make home visits. They're out in the community. They're driving all over the back roads of Vermont to see our clients, to make sure that they're doing well, and to kind of see how things are going in their homes. So with the COVID-19 pandemic, we have had to cut back really all those home visits, and so it's really made it challenging to get the full picture of how people are doing. We've really stepped up our phone services, and in some ways, we are now having more contact with our clients on a more regular basis. But it just isn't the same, it's not the same as having a friendly, smiling person come to your door and sit in your living room and pet your dog and talk to you about how you're doing and notice if your refrigerator is empty and maybe get you signed up for Meals on Wheels. So it really has a profound effect. And it's just harder to tell how folks are doing over the phone without those visual cues that we rely on to see, when they get up and move around, how is their how are they getting around? Are they stumbling? Are they having a harder time? Those sorts of things you just can't really detect those over the phone. And I will also say that this Choices for Care program relies on home-based homemakers and caregivers, and those services were also pulled back because we didn't want our clients getting sick. So it was really a tragic dilemma. How do you help these clients who are at home and need services, but don't put them at risk of contracting the virus? So everyone, our services and the homemaker services through the VNA and Beata home care really worked hard to ensure that the clients continue to get some service, but not in a way that was going to put them at risk or put the care providers at risk. So it was really quite a dilemma, and certainly those in-home services were cut back, and people just didn't get the services that they needed. So that was a challenge. And then also similarly, Meals on Wheels delivery, which we support financially. Meals on Wheels drivers, delivery people, they are a tremendous asset in terms of visiting folks and again seeing, do they have any other food in the house? What are the conditions of the house? So what our Meals on Wheels delivery people had to do then was basically make a delivery, hang it on the doorknob, and retreat to their car to just watch to make sure that the recipient got the food. So it has profoundly affected our services, and we've seen the effects of that on some of the clients for sure.
I think that must be heartbreaking.
Yeah, absolutely. It's social isolation. If you read the literature, so there's some studies out there that say social isolation is as detrimental as smoking a pack of cigarettes a day.
And that can't be good. Oh my goodness.
No.
Oh,
That's why our volunteer program is so special, because our volunteers still maintain connections with many of our clients, and I think that's an important offering that we have.
Yes, we had an outpouring of volunteers who wanted to help out during this period, and they did all sorts of things: running errands, picking up groceries for people, picking up medications for people, running errands, things like that, which were invaluable to our clients.
Right.
Absolutely.
Yeah, and when the weather was nice, some of them even started doing porch visits at at a good social distance. But now, I don't think anybody really is considering sitting out on a porch.
Yeah, it's
so we're constantly evolving and trying to figure out how to solve the next problem. But Mark, what you have to say is very thoughtful. And I'm wondering, you serve on a lot of different community boards as well. You're all over the place in Windsor and Windham County. Could you share some of those experiences with us?
Sure, I'd be happy to. So I am all over. Sometimes I think of myself as somewhat of an ambassador for Senior Solutions.
Right.
But yeah, and I guess maybe based on my growing up with a father who was standing in front of a congregation, I feel somewhat suited to that. So I'm happy to be out there and preaching to the masses. So I'm very active with the local hospital community health teams, both in Springfield and Mount Scottney Hospital. Those teams are very active with providing really again, care services for their clients, for our mutual clients. So we do a lot of collaboration around mutual clients who are in need of various services and supports. So that's very rewarding to work on those teams and see everyone collaborating together, trying to solve challenging problems for folks who are living in the community. I also at Mount Scottney, I lead a work group that's part of the Community Health Improvement Project, which came out of their community needs assessment. So for the past couple of years, I've been leading this senior health work group, and we've really been targeting how to reach out to seniors in the area and provide resources. And one of the wonderful aspects of this area of Vermont is that we have a multitude of cares groups and aging in place groups, which interestingly don't exist in the rest of the state. And these groups,
I never knew that they didn't have it anywhere else.
No, it's curious that they don't, because, and it's unfortunate, these groups really fill an important gap in services when, because they're providing, many of us, like the VNA and Senior Solutions, are providing services that we can bill for. And often people who have needs that don't fit in those sort of billing categories, they fall through the cracks. And these groups are reaching out to their folks in town, folks, way up in the hills, and they're keeping track of them. They're figuring out what, do they have food? Do they have transportation needs? Are they getting to their doctor's appointments? And so we're very active in supporting those groups in Heartland and Reading and across the area. So that's one of the areas that I'm very active with, those groups, and
Yeah, I like them too, because it's almost like they're just helping each other's neighbors. You can almost figure that word of mouth can help somebody. The word gets around in the communities, and that's
absolutely.
Great. And I just want to clarify one thing. When you say that they serve people that we can't serve because we can't bill for it, I know what you mean. We bill the government, or we build grants or whatever. We don't ever bill the clients, do we?
That's correct. We're not. You're not going to get a bill from Senior Solutions saying you owe us for our services.
Yeah, you'll never get an invoice, right?
That's true. That's true.
That's great. Really nice work with those communities. Wow.
Yeah. So that's just one of the many groups I'm part of. I last winter I served as a faculty member for this project through the Tri-State Learning Collaborative, which is Vermont, New Hampshire, and Maine. And that project had a monthly, basically a case conference session where a group would present a challenging case, and someone with dementia or Alzheimer's or some other age-related difficulty, and this group would problem solve and make recommendations. That was a very enriching program that we participated in, and many folks in this area and with Senior Solutions got to sit in on those sessions. I also am an appointee to the Vermont Governor's Commission on Alzheimer's and related dementias. And this is a really important group, because it really takes our work to the next level, which is making recommendations to the legislature, saying this is what we're seeing out there. This is, we see that aides in nursing homes don't have enough training. They don't really understand Alzheimer's. Or we see that homemakers providing home-based services for choices of care are making barely minimum wage, or a variety of things. One of the most recent initiatives we worked on was implementing dementia-friendly community models around the state, which is working with merchants and employers and communities around how do you make your community dementia-friendly, to the way you display products in your store, to signage, to all sorts of things that assist folks with dementia in navigating around the community. So that's an important aspect that I really,
Sounds very important.
I really love being on that commission and having contact with our legislatures.
Nice.
I was also just again active with the Springfield Agency of Human Services COVID-19 emergency response team. And we still meet because obviously
We
COVID
still have COVID.
is still with us.
That's for
Unfortunately.
sure.
Yeah, so I spend a lot of time on Zoom meetings these days, but it's one of the things I love about Vermont is I really feel connected locally, but also statewide. And it really is rewarding to be part of these groups and to have a voice at the table.
I think that's a real benefit to living in a small state with a small amount of people in it. We do have our isolation issues, but basically, if you want to talk to somebody in our state, you usually don't have any problem reaching them. And I think that's a great benefit, especially for somebody like you, who, when they talk to people, have something substantial to share with them. So I like that. Yeah. Jim, what's your next question? Anything?
Well, one question that I think is really important is you must have something to do with the budgetary process that we go through. So how do we get the funding to be able to offer the programs we offer?
So the funding at Senior Solutions really is from multiple sources. As I mentioned earlier, the only really direct revenue stream we have is through the Choices for Care and Moderate Needs Medicaid programs that enable us to bill for our services. But we do get some funding through the federal government, through this Older Americans Act, which I mentioned. And so that has some funding for various services to outreach to seniors for around making sure they know about fuel assistance and nutritional services and transportation services. So the Older Americans Act outlines a number of areas that we are responsible for really providing outreach to. So Medicaid, Choices for Care, federal government, Older Americans Act. We do have several grants through the state. Again, I mentioned Meals on Wheels. So we have a grant to support Meals on Wheels, and we get a little funding through that. We have a grant to support 3 Squares Vermont, which is food stamps, and do outreach for that. We have a variety of state grants, transportation grant, things like that we get, basically administration, money for our administration. And then our current CEO has been tremendous in reaching out to the private sector or other areas for grants, such as our Elder Justice grant that she got through the Department of Justice, through the federal government a couple of years ago. And this was a huge grant that enabled us to put together a program to really address elder abuse and exploitation in our area. So certainly one of the important aspects of any nonprofit are the grants that we are able to bring in. Another federal grant is through the National Council on Aging to do benefits counseling. So that's important. That's important. Those are important funding streams that enable us to really broaden our services to reach a number of constituents out there that we wouldn't otherwise be able to do. And of course, for all those of you who are out there listening, we always welcome some donations. So we do take donations. We don't do a huge donation drive, but that's certainly an important part of our income or our revenue. And many of the towns that we serve provide us some funding.
Yes.
So we're happy to provide services and go to town meetings. I always stand up at my town meeting and talk about the services that Senior Solutions provides, so that those people know when it comes up for a vote what they're voting to support.
Exactly.
I know one of the services that I don't think sometimes our community is aware of. They're hearing all these advertisements now, although the deadline is over, about Medicare. And this is the time to look at what you have for Medicare and look at some of the other opportunities you have to save money. And rather than go down to the local insurance agency, they have a stake in an insurance policy where if you call our helpline and make an appointment to talk to our Medicare specialist, they can save you a lot of money. I had to do it myself this year. And one of our, Sarah Tilden, one of our Medicare specialists, really helped us and brought a lot of attention to some of the things that we didn't do right initially. So we really appreciate those kind of services that are offered to all community members.
Thank you for bringing that up. We've talked a lot about Medicaid, but the lion's share of Vermonters who are over 65 are on Medicare, and we do have a crackerjack Medicare team. And yes, the Medicare Part D pharmacy open enrollment just ended yesterday. It runs from October 15th through December 7th. And during that time, our Medicare specialists are assisting multiple people back to back all day long in looking at their pharmacy plan and deciding, helping them to decide what is the best plan for them in terms of saving money and getting the prescriptions that they need. So we have just come off a very busy time on our helpline, taking calls around Medicare Part D, and I can't say enough good things about our Medicare specialists who, boy, they can tell you every little thing about Medicare that you ever wanted to know.
And what they do that is very smart. What they do is they don't say, this is the plan you need to take. They map it out. They put a little chart together. They explain it, and then you make that decision. And then they enroll you. It's a very good, make common sense process.
It's not our role to decide for you. We'll give you the information and we will give you guidance and information, and it's up to you to decide. Sometimes people make decisions that probably later on they come back to us and say, well, that probably wasn't the best choice. And that's fine with us. We don't make judgments. We'll help people.
Right.
When they come back, we'll try to straighten out if they made a choice that wasn't the best for them. You bet.
Well, and also sometimes, people's situations change.
Absolutely.
And they don't always know what to do when that happens. So very fortunate that we have a helpline and a good team that if people call, we can certainly help.
Yes. Actually, that I'm going to jump back to your original question about some of the services we provide, and
Great.
one of those services that we have for people who don't know what to do or when their life changes is called elder care counseling services, and that program is a program we have with HCRS, the local mental health agency, to provide therapy services, counseling services to folks who can't get into a clinic, who can't get into the HCRS offices. So HCRS sends a therapist out to their home to provide some therapy services when they are grieving the loss of a loved one, or when they're depressed and socially isolated and can't kind of get things together. So we do have this excellent
That's
elder care
amazing.
program through HCRS that supports those folks who are have those kinds of needs.
And I imagine now that, we're heading into the winter with the COVID-19 and all of that it brings along with it, those services are probably going to be in pretty big demand.
Absolutely. Yeah, people certainly are feeling the effects of being isolated.
So anybody out there, if you're feeling like you can't handle your sadness, or if you've lost a loved one, give us a call. If you don't know the helpline number, here it is, 802-885-2669. And somebody will answer and be happy to direct you to the right place for the right services. Thank you.
Let me just jump in and say the toll-free helpline number is 866-673-8376.
Great. Thanks, Mark.
Great.
Sure. Just a couple of other programs that we offer.
Wait, no, you have more than just a couple. We can only fit in a couple more.
I tried to limit the list here.
So go ahead, I'm sorry.
But clearly one of the areas of importance across our region, and this is another area again that's really heightened by the COVID pandemic, is the need for caregiver supports. We have so many individuals out there caring for loved ones with dementia, with just medical needs or physical needs or emotional needs. And those people really often go unrecognized because they're leaving their jobs early, or they're going from work to their parents' homes and making dinners or any of these kinds of things, or a loved one whose spouse is developing dementia and they're struggling to provide care. We have some services that support those folks. We have some respite grant services that help pay for care. We have other support services and groups. For instance, one of the areas that we see a lot of are grandparents who are raising their grandchildren. So we have in the past run support groups for those kinds of folks. So that's just another area. We're working on developing something called a memory cafe, where people can probably come through Zoom and do some focused reminiscing or talking about the past, and that's a way to feel supported. So we do provide a lot of caregiver supports as well, and again, that's when you think of the numbers of older Vermonters in our area, that's a critical need. There are many folks out there who are providing care for a loved one in their homes.
Yeah, and sometimes they just need to recharge their batteries.
Absolutely. It's so.
Have we provided? I think you've had a lot to do with this. Computers for our population that so that they can attend Zoom meetings, etc.?
Yes, absolutely. One of the sort of upsides of this pandemic is that the government has helped financially in many ways, and one of those ways is that they have provided grants to the agencies on aging around the state to find ways to support seniors. And so the way that Senior Solutions used some of this grant money was to purchase laptop computers or tablets or iPads, and then loan them out to consumers who are isolated or in need of some sort of connection. And again, another area that this is really critical is that a lot of the hospitals and medical providers have turned to telemedicine. So that's great if you have a computer, but if you don't have a computer, which many of our older Vermonters don't, or you have one that you could never figure out how to use, and so you just stuck it in a drawer somewhere. This grant is targeted at providing computers and providing instruction to help people get set up. Actually, just this morning, I was talking to one of our IT specialists about how he could provide some instruction to a client who just got a computer, got a laptop, but doesn't know how to connect for a telemedicine session. So we're going to provide some support and instruction for that client to get connected.
You're so right, because, all the equipment in the world won't help you if you can't use it.
That's correct. Right.
And, so many of our older generation, it's easy to get sort of overwhelmed with how do you navigate around this thing, and what are all these little pictures of things on this iPad, and how do I make it work? So so we're thrilled to be able to provide support in this area, and it's really a critical need. Actually, right now I'm working with Mount Scottney Hospital and the old Windsor Village, which is a HUD-supported housing facility in Windsor, and we've provided 10 laptops to residents there, and we're providing financial support to get the whole building wired, because it's not just the tablet and the instruction. A lot of places in Vermont, you don't have access to the internet. So we're providing support to get the whole building, the whole Windsor Village building wired for Wi-Fi.
Wow.
And I just put one of the coordinators of that program in touch with a person we've contracted to provide instruction to clients on how to access these services through their laptops.
It's amazing.
Great. The other service that we offer, I think, is important, is that we have our own nurse on staff who has done a great job. She's part of the Pearls process, where we do a counseling for people that are feeling depressed, but not enough to be, have to go to a hospital or anything else. It's more or less, how do I manage how I'm feeling, and those kind of strategies. The other things I think she does is something with calls some of our clients and helps them establish home med surveys that she puts out, and it's a great system. And I think that people don't realize how many things we have going on at Senior Solutions.
That's
All right.
It's true. There's a lot going on. Yes, the Home Meds program that Ann White administers. Again, a terrific asset. When you think about the numbers of the different prescriptions our clients take, and how confusing that can be. And then you think how that contributes to falls. Someone takes a
Oh, true.
medication wrong, at the wrong time. They get lightheaded, they fall down, they trip over something. So this is really a critical service to help our clients, understand what the medications are that they're taking, what they're for. Are they taking too many? Are they taking them at the wrong times? This
Right.
home meds program contracts with a pharmacist who can flag problem medications and things like that. So yes, this is it's a wonderful program to support our seniors to stay healthy in their homes and
Well,
be
it's
able.
true. It's
Yeah,
true because I always tell people that it can be a real lifesaver. Because
absolutely.
as you get older, doesn't your medicine cabinet get a little more full? And you may have things in there for years, and maybe you have that same kind of funny feeling that when you first got that prescription, it helped. But now you're taking other things over the counter, herbs, you name it, right? Vitamins. None of us know how those chemicals react inside. So if they get this home meds assessment, it's so helpful. And we don't tell you what to do. When the
Right.
pharmacist completes the diagnostics, we'll send the results to that person's primary care physician.
Yep.
And then the primary care physician and the person figure out they're going to replace the medicine, throw it out, whatever. And it's totally free, and nobody even has to become a client of ours. So, it's wonderful, and I can't encourage people to do that enough. Thank you for bringing it up.
The way we metabolize those medications changes with age. So
Yeah,
maybe the right medication, but the wrong dosage. Yep.
very possible.
Right.
Yeah. Now, well, looks like we're kind of getting near the end of our show time. But if there's anything that you'd like to, remind us about or throw into the discussion, now's a good time.
Well, when we were talking earlier, you asked a little bit about the current economic situation in Vermont and across the country, and how that is going to affect our agency and also our clients and our constituents. And if you're not aware, Vermont is ranked second in the country for the oldest population per capita. So next to Maine, actually Maine, New Hampshire, and Vermont sort of keep trading places for the oldest
We're
population.
so competitive.
Yes. And that's just going to increase over the next 10 or 20 years. And also another interesting bit of data is that Windsor and Windham counties have the highest density of older Vermonters in the state. So if you think about it, Windsor and Windham counties have kind of the highest density of older adults in the country. So we really have, a big group of folks that we need to serve, and those services aren't, they're not going to go. Our services aren't going to go away, and we're going to need them even more than we do now.
Right.
The challenge is that as this population grows, the group of the workforce, the caregiver workforce, is diminishing. And so there's this increasing gap between the need for those services
Right.
and the labor force that provides them. So, one of the really important pieces of work that I'm focused on is really working upstream around how to find ways to support these professionals and paraprofessionals who are out there caring for our most vulnerable constituents. And so how do we work with the state? How do we advocate for better wages and more opportunities for training and education so that these dedicated, caring people who want to help can make more than $13.50 an hour, providing these critical services. And when they're making those kinds of wages, they just can't stay in the field. They're looking for better work. They're maybe supporting a family. So that's one of the areas that I think is a critical need right now. And we are talking with folks at the state about this, about how to address this shortage. And if there's a workforce shortage, that limits the amount of service Senior Solutions can provide, because we can't enroll people in services when those services just aren't out there to be had. So I just wanted to sort of end with that thought about this critical need in our state as we look ahead to the next 10 or 20 years with an aging population, and think about how do we really support those people. And one of the ways is finding ways to support the people who provide services to them, the people on the ground, the boots on the ground. And really, that's going to be a critical need it's a critical need right now. Right now, we have people who don't get the service they need because of this economic situation.
That's a
I
really
think
good
that's
point.
important, very important. And the other thing, just to add to the burden, consider how now all of our hospitals, all of our medical aides, all these people are getting completely overburdened with work. So it's going to be a real challenge, but we have to hope and make sure that the need is expressed so that people coming into our state, people just coming out of school, will be challenged on how can they help our society cope with the changing demographics, and how are we going to care for each other as we age. Well, Mark, I have to thank you. You've done a wonderful job presenting, what you do and what Senior Solutions does. And I've learned a lot from you, believe it or not, just through this hour. I really have.
Well, thank you, Joanne, and thank you, Jim. It's a
Will you
pleasure.
come back sometime?
I'd be happy to come back.
All right.
Yep.
Sounds good.
Absolutely. Thanks again.
Excellent.
Thank you.
Well, I guess we'll sign off. So Jim and Mark, see you back at the office eventually.
Yes.
You'll see me with my mask
Thanks a
on.
lot.
Okay, great. Thank you, everybody.
Bye-bye.
Bye.